Ladies and gentlemen, good afternoon. Before we proceed with the program proper, may we request non-signatories of the Memorandum of Agreement to turn off your video cameras all throughout the program. You will have the chance to show your gorgeous looks at the latter part of the program. Thank you. Welcome to another milestone collaboration between the Development Academy of the Philippines Graduate School of Public and Development Management and the Ilocos Training and Regional Medical Center. On September 9, 2020, DAP-GSPDM and ITRMC officially sealed its collaboration through a Memorandum of Understanding to signify both agencies' intended common goal of achieving an improved healthcare system for the country. Today, February 2, 2021, both agencies will officially be signing a Memorandum of Agreement to cooperatively work together in identifying organization and management gaps, in implementing customized programs for the ITRMC, and in creating ITRMC's very own Center for Health Systems and Development. I am Quincy Liner Agas, your overall moderator for today. To welcome us all to this momentous occasion, may we call on the virtual floor Dr. Eduardo M. Badwa III, ITRMC Medical Chief Officer.
Magandang hapon po sa ating lahat. To our partners, members, the President of the DAP Graduate School of Public and Development Management, and all the members of the faculty of the DAP. Let me take this opportunity to particularly greet the members of our Multi-Sectoral Governance Council, or MSGC, of the Ilocos Training and Regional Medical Center. Mr. Alvin R. Malikdem, the Dean of the College of Information Technology of the MMSU Middle La Union Campus, Dr. Eduardo V. Regala, the Chapter Chairperson and Board of Directors of the Philippine Red Cross La Union, Mr. Ronald D. of the Rotary Club of San Fernando, La Union, Director Eugene G. Cabrera, the Regional Director of the Office of the Civil Defense, Dr. Jeneline Role, the Regional Director of the Philippine Information Agency, and of course, Honorable Aureo Augusto Nice, the Chief Executive Officer of AQN Group of Companies. I would like also to greet Police Colonel Yesemir N. Protasio, represented by Colonel Aguda, the Assistant Chief Regional Health Service of the Philippine National Police. And of course, thank you to the director, our director of our mother unit, the Center for Health Development Region 1, Director Valeriano Valdez Jr. The implementation of Republic Act 1123 and the emerging trends of infectious disease, exemplified by the current COVID-19 pandemic, compelled the hospital, the Ilocos Training and Regional Medical Center, to reconsider its position in planning for the future. The passage of the Universal Healthcare Act marked a new beginning for healthcare in the Philippines. The COVID-19 contagion proves that even the best of public health interventions, there will even be more demand on hospitals in the future. The governance, performance, and preparedness of hospitals, therefore, is a very critical policy issue. It is clear that even the biggest and the most advanced hospital in highly developed countries can be easily overwhelmed by a pandemic such as COVID-19. Situations like what we have right now can only be mitigated by a prompt and decisive political intervention and a strong health system. The UHC law provides a clear platform for the development of a responsible health care. As ITRMC develops fully functional that are fully aligned with the hospital development plan. And to be an apex hospital, it needs to have a link with other healthcare providers. There is a need for an effective network between the Center for Health Development Region 1, the Ilocos Training and Regional Medical Center, the Provincial Health Office, as well as private hospitals and other stakeholders to ensure that people with complex needs can be managed in the most appropriate setting and by the best provider to meet their needs, whatever that may be. We are seeing the value of this invaluable cooperation in this time of COVID. We know how important when the roles are clear and the responsibilities are well defined. This is now the opportune time to strengthen the grid and create a well-structured system. It is in this regard that we are forging partnership with the Development Academy of the Philippines, Graduate School of Public and Development Management, or DAP-GSPDM, Health, Governance, and Social Protection Cluster, in order with the aims to conduct an organizational study, an audit for ITRMC, our provincial hospital and district hospitals, and to conduct a rapid scoping of organizational gaps and identify, design, and as appropriate, implement technical cooperation projects to include faculty and curriculum development, among others. It also aimed to collaborate in the implementation of cooperation programs through joint sponsorship forums, workshops, common research studies, and project missions. And lastly, establishment of a Center for Health Systems and Development for ITRMC. This partnership will further consolidate and strengthen the Ilocos Training and Regional Medical Center as a key part of the goals and targets of the Center for Health Development Region 1 and the Department of Health as a whole. This is in parallel to the health programs of the province of La Union and responsive to the health needs of the Ilocos region in general. Maraming salamat po at sa inyong attendance ngayon dito po sa Memorandum of Agreement signing.
Thank you very much, Dr. Badua, for those inspiring words and for your leadership in paving way for ITRMC's higher development. Attorney Engelbert C. Caronan Jr., DAP President and Chief Executive Officer, would not be able to join us today, but expresses his regards and congratulations. We also have with us ITRMC's Head of Professional Education Training and Research Office, Dr. Mario Gerardo Tolentino, to deliver ITRMC's commitment to this collaboration.
Good afternoon, everyone. To Dr. Lisan Perante Calina, Senior Vice President and Dean of Graduate School of Public and Development Management, DAP, to our Medical Center Chief, Dr. Eduardo Badua, to the members of the Multi-Sectoral Governance Council of La Union, to our dear CMPS and all here present to witness this virtual MOA signing. Good afternoon. Ilocos Training and Regional Medical Center is a unique health institution, ever true and faithful to its name, equates its medical function to its capacity as center for training. We have here 12 accredited clinical training programs. We likewise is an accredited CPD provider in medical, nursing, and other allied services. This institution is a center of dynamism in the actualization of everyone's pursuit of excellence in health provision, research, and innovation. In line with this vision, partnership with the Development Academy of the Philippines has provided us a clearer path towards upgrading and realizing the ultimate goal of becoming the best training institution, unique and responsive to the needs of the present time. ITRMC, therefore, in behalf of our Medical Center Chief, Dr. Badua, our Chief Medical Professional Staff, Dr. Unity Cortez, all our division heads, and all to whom we represent, commit ourselves to this challenging endeavor and promise to fulfill all the duties and responsibilities due to us in this Memorandum of Agreement with the Development Academy of the Philippines. May this partnership be fruitful and mutual to all of us. So help us God. Good afternoon.
Thank you for that thoughtful message, and we are grateful to be in partnership with ITRMC to help you guys to realize your vision. Again, thank you, Dr. Tolentino. At this point, we will be witnessing the simultaneous virtual signing of the Memorandum of Agreement between the DAP-GSPDM and ITRMC. May we request all heads of both agencies to sign all 7 pages of the document. Witnesses, kindly affix your initials on the last page. Attorney Engelbert C. Caronan, DAP President and CEO, has signed the document already, and signing on behalf of ITRMC is Dr. Eduardo M. Badua III. Signing as witnesses are Dr. Lizan A. Perante-Calina, Dean of the DAP Graduate School, and Dr. Unity H. Cortez for ITRMC. So thank you, dear leaders. May we request that you raise the signed documents in front of your video cameras for our photo documentation. Kindly flash us your gorgeous smile on the count of 3. 1, 2, 3, smile. Thank you, leaders. The signed Memorandum of Agreement will indeed be the start of a productive year for both the DAP-GSPDM and the ITRMC, and we can't wait for the first activity to take place. To formally close the event, may we hear an inspirational message and closing remark from the Dean of the DAP Graduate School of Public and Development Management, Dr. Lizani Perante-Calina.
Thank you very much, Prince. To our collaborators from ITRMC, Dr. Eduardo Badua III, ITRMC Medical Center Chief, Dr. Unity Cortez, ITRMC Chief Medical Professional Staff, Dr. Mario Gerardo Tolentino, Head of ITRMC Professional Education Training and Research Office, Dr. Marvin Munar, ITRMC Medical Specialist, Dr. Valeriano Jesus Lopez, Regional Director, Department of Health Center for Health Development, Dr. Maureen Bellio, Assistant Regional Director, DOH Center for Health Development, Mr. Bernardo Dizan, DAP Senior Vice President for Services, the Health Governance Social Protection Cluster Learning Management Team, to the members of the Multi-Sectoral Governance Committee, to our guests, a pleasant day to all of you. Indeed, this afternoon, we are again into a knowledge co-creation activity. And this collaboration actually is a manifestation of our commitment. And with that, on behalf of the Development Academy of the Philippines, the DAP Graduate School is privileged to work and mark this continuing collaboration with ITRMC through the signing of this Memorandum of Agreement. But even before this remarkable event, we already had our initial knowledge co-creation activities prior to this global health pandemic. So this collaboration, as I mentioned earlier, is a manifestation of our commitment, especially to realize the 17 Sustainable Development Goals, particularly SDG number 16. And that is about strong institutions. So we here at DAP, we continue to provide relevant capability building programs in order for us to further capacitate our civil servants. So we are inspired by the commitment of the health sector in providing efficient interventions with an overarching philosophy of primary care, which is health in the hands of the people. The Philippines, amidst the pandemic, is grappling with the reality of the principle of no one should be left behind. Yet we will not remain daunted as we surmount the challenges of social inequities, as we remain innovative and agile. And being agile is really about embedding ethics and culture, especially our own culture, and that is really contextualizing governance in the Philippines. And together, we can reach our dreams and aspirations. That is why we're able to craft, along with other colleagues in the academic community, the so-called Hiraya Foresight Framework. So why Hiraya and what is Hiraya? Actually, Hiraya is an ancient Filipino word appropriate to symbolize the aspirations of the Filipino people. We're able to craft this along with other colleagues. And as I mentioned, it is about our aspirations as Filipino people. And Hiraya Foresight gives the potential of the future, of tomorrow, to illuminate on the present. Hiraya glows and radiates, for it subsumes a lot of unexpressed meaning significances and meaning implications. And Hiraya is about vision. Hiraya is optimism, positive thinking, preparedness, and alertness. Hiraya is anticipatory and agile leadership and governance. Hiraya implies that the future can be studied, especially the futures of health. It can be analyzed, it can be researched and planned. Hiraya can be institutionalized and systematized through foresight education, research, and advocacy. That is why we are here today, to really impart and really further our knowledge co-creations, not only using Hiraya Foresight as a tool, but also using phonetic leadership as an anchor. And we did that last time. So with this, the DAP Graduate School is really your starting point for your, of course, furthering your intellectual training that involves phronesis and Hiraya Foresight. And again, this collaboration between DAP and the Graduate School and ITRMC with futures of health in mind is one of the many innovations in changing the healthcare system in the country. This Memorandum of Agreement signing signifies the start of a project that will greatly contribute to the realization of our universal healthcare law. ITRMC may be the lead with this project, and of course, we are really expecting that you'll be able to cascade, and not only to cascade, but also be an inspiration for other hospitals and medical center to really implement or replicate this best practice. So with that, and with our collective resolve, courage, respect, honesty, humility, and discipline, we can reach our dreams. Hiraya, manawari, at magandang hapon po sa ating lahat. Congratulations.
So we also thank our guests who joined us here on Zoom and those who joined via Facebook Live. For those who wish to watch the full video recording of this event, you may follow GSPDM by subscribing to our YouTube channel, DAP-GSPDM. We also invite you to visit our website, www.gspdm.com, and like our Facebook page, DAP Graduate School of Public and Development Management, for updates on our program offerings and activities. Thank you all for attending. Let us all work together in equipping leaders, developing competencies, and in building a nation. Good afternoon.